Hi everyone, it's Josh at Prescription Fitness Physical Therapy and Sports Care. Again, doing another video for you. As I promised earlier in the week, we're going to try to do one as often as we can for October, which is National Physical Therapy Month. So today's real question is, what does your physical therapy look like? What does a treatment session look like? What should it look like? I hear a lot of comments from other patients. They might attend physical therapy. It's sort of a set time frame. You go in at 8 o'clock, and at 8:30 you're walking out the door. And the physical therapy intervention really just looks like therapeutic exercise, which I think, in my opinion anyways, I think a multimodal approach is really what facilitates the greatest changes. What really drives the patients to physical therapy is what we do here in the clinic with the patient. Certainly education is paramount. Our manual therapies, our hands-on approach, it gives us a lot of information, a lot of feedback as far as what is the patient's problem, how does the patient's problem evolve over the course of the treatment, which is super important. That feedback really helps to guide us in where we go with things. So I'm just curious, is it I go into my physical therapy office, they slap a hot pack on me, they watch me do a couple exercises, and they ship me out the door, or is there a more involved approach? Is there a lot of technology? What are they using, and is that important? Is that something that we should expect in a treatment session? So modalities, and for those who don't know what a modality is, it's something that we might use to as an adjunct to facilitate the healing process in our treatment. It could be electrical stimulation, which we can use for pain modulation. We can use it for muscle re-education. Could it be cryotherapy, ice or fancy ice machines, or neurocryostimulation, which a lot of people probably don't even know what that is. We'll be talking more about that in future videos. Do they use lasers? Do they use shockwave therapy? Are those technologies important? Whoop, phone. Is that something that we should expect our physical therapy practice to be doing with us? And is it necessary? Nothing is a panacea, but I think definitely approaching things with multiple prongs is better than just approaching it with one. I think the common mistake with younger therapists or entry-level therapy is just throwing a lot of things at a patient. So tons of therapeutic exercises. The internet is full of YouTube videos where you can see cool, fancy exercises, and who doesn't want to do cool and fancy exercises? But is that what we need to do? So I'm an older therapist. I've been doing this for a while. So I'm big on, let's go old school. Let's use the stuff that we know works. And other therapists who I think are in the same age group, we understand that. Do what works. Do what is based upon what the literature shows us. But also, it's not just empirical evidence. It's what do we see here in the clinic. So yeah, just curious to see what people think. Maybe you can write us a couple sentences on what does my physical therapy look like, and we can kind of go through what we do here at Prescription Fitness Physical Therapy and Sports Care, and I'll break things down as far as what some of the modalities we have here in the clinic. What are they? What do they do? And how that affects your treatment. So love to hear from you guys. Again, feel free to paste and post things to our website and share these posts. It'd be great. Thanks again. We'll talk to you soon.